Good afternoon, folks. Thank you so much for joining Advocates for Ohio's Future in our PHE Public Health Emergency Unwind webinar this afternoon. We appreciate that you're here with us. My name is Kelsey Berkfeld. I'm the Director of Advocates for Ohio's Future. We are a nonprofit, nonpartisan coalition of a bunch of health and human service policy folks, researchers, providers, really united to make sure that Ohioans have what they need to live really healthy, successful lives and quality communities. So we're really excited to have such a robust team and teammates here at AOF present to you some of the work that we've been doing over the past few months. Again, considering the end of the public health emergency is looking like it's coming to a close very, very soon, and really the impacts that we'll have on some of the folks that we serve and some of the policies that we advocate for. So very quickly, we'll move to our next slide. A minute about AOF. Again, we're a coalition of lots of teams and lots of different organizations that you will hear from shortly. And really, we're diving into the end of the public health emergency today. So since January 2020, a number of COVID-related, again, enhanced benefits, waivers, program flexibilities, and eligibility have been in place, really designed to make sure that families who are struggling have those extra supports in place while everyone was facing challenging times during the pandemic. Again, we know that the pandemic is still happening, and those enhanced benefits are still in place at the moment, and many of them are tied to the federal public health emergency declaration. So we know last summer, a bunch of organizations around the AOF table got together, starting to think about what it would look like for those programs to eventually unwind or off-ramp as those enhanced supports start to fall off, I would say. We have coined the term the COVID cliff, knowing that a lot of families, given the timeline that we are presented with, a lot of families will face reductions in benefits, maybe termination of coverage, all within a few weeks or a really short time period, knowing that that will face or really create some additional challenges for families during an already challenging time. We know that there's been an increase of cost of living and inflation to consider as well. Families are starting to struggle from that alone. So we came together around the AOF table and asked ourselves, how can we ensure that state, local agencies, providers, and impacted Ohioans are prepared for the PHE unwind and make sure that we can do what we can to mitigate the impact of the COVID cliff. What do? We put our heads together and we created the Ohio COVID Recovery Coalition, again, working with the administration and others and a lot of our policy experts and community organizations to come together and think of different ways we can mitigate harm. And again, work together to make sure that we have processes and those supports in place as those enhanced benefits and others start to unwind. So quick run of show today. We created 3 different work groups and led by members around the AOF table. We're excited to hear about healthcare. Again, that will be today. First up, from 1 to 1:30. At 1:30, we'll hear from our nutrition team, our leaders, from 1:30 to 2 o'clock again, and then family stability and supports kicks off at 2 o'clock. So feel free to hop off and on as your schedule allows and as your interests lie within these work groups. Very, very quickly, frequently asked questions we know you're going to ask. The webinar is being recorded. The full recording and slides will be sent out to all registrants tomorrow morning, and they'll also live on our website, which is linked in the slides as well. And if you have a question at any time, please feel free to enter it within the chat box or within the Q&A function. Without any further ado, I would like to introduce our first set of speakers. We have Lauren Anthus from the Center for Community Solutions and Kelly Viseral from Children's Defense from Ohio to talk to us about the COVID cliff and its impact on healthcare. So take it away, Kelly and Lauren.
Hi, everyone. Thanks for joining us this afternoon. My name is Kelly Viseral. I'm the Senior Health Policy Associate with Children's Defense Fund Ohio. And I'm glad I'm going first because we have a really impressive lineup of panelists coming after me. So it's always good in that situation to go first. So how did we get here? In January of 2020, Health and Human Services declares a public health emergency because of COVID. By March 9th, we see the first case reported in Ohio. March 11th, the World Health Organization declares a pandemic. March 20th, Ohio's first COVID-related death happens, and the next day, Governor DeWine announces Ohio's stay-at-home order. Next slide, please. The federal government acted quickly to pass a couple of bills to help families now that no one could work outside of their home. They passed the Families First Coronavirus Response Act, which is intended to help families stay healthy and protect themselves against the pandemic. It provided Ohio a temporary increase, or provided all states a temporary increase in the federal Medicaid matching rate of 6.2 points if they would stop disenrolling and redetermining people on their Medicaid program. So everyone stays covered by Medicaid during the pandemic, and states earn this extra money. For Ohio, that meant $300 million per quarter extra. And the CARES Act was the next stimulus bill that was passed by Congress, and this bill addressed many of the economic issues facing the country. It paid the unemployment. Of course, someone decided to mow their lawn. Okay, it provided for unemployment insurance, sick days, family leave, family and medical leave, access to testing, treatment, and prevention, and it funded community health centers and provided aid to state and local governments. Next slide, please. And if we're going to look at maternal and infant health, one of the most important things that the next COVID recovery plan did was the American Rescue Plan. That was passed in March of 2021. And I think ARPA could be argued as having the biggest long-term impact on maternal health of all the COVID recovery bills. The inclusion of language expanding Medicaid coverage for a full 12 months after a woman gives birth really did open the door to allow Ohio to add this benefit to their Medicaid program and draw down those federal funds. Ohio did add that language to their budget bill in June, and it's estimated that this is helping approximately 14,000 women continue to be able to access that care during the critical year following a birth. The next slide, please. In the wake of the coronavirus, the state of Ohio took several measures to alleviate the devastating effects on the health of Ohio families. They applied for a disaster relief SPA and an 1115 waiver, which allowed states to modify Medicaid requirements standing in the way of providing services to enrollees during the pandemic. Ohio's approved waiver included allowing hospitals and the Medicaid department to make presumptive eligibility decisions, suspended cost sharing for Medicaid beneficiaries, expands providers eligible to provide telehealth services and the types of services that could be provided over telehealth. And it established automatic renewal of prior authorizations for medicines. In October of 2020, Medicaid made some telehealth changes permanent, which I think is one of the best things to come out of the pandemic, it expanded the definition of telehealth to include telephone calls, remote patient monitoring, and emails. It expanded the types of practitioners who are eligible to provide telehealth services, including home health and hospice aides, behavioral health practitioners, Medicaid school program providers, optometrists, dentists, dietitians, and physical and occupational therapists. There were fewer restrictions on patient and practitioner site locations, and it expanded the types of telehealth services that could be paid for by Medicaid to include a virtual check-in, online digital evaluations, management services, and remote patient monitoring. Next slide, please. They also passed some community-based service waiver, which made it easier to access the home and community-based services by permitting virtual assessments and person-centered planning meetings, modifying processes for level of care evaluations. The waiver expanded services and settings, adjusted service limits, extending reassessment dates, adjusting prior authorizations, and allowing alternative settings for home and community-based services. And it also strengthened the workforce by expanding paid family caregiver limits and increasing pay rates, which was really important. Next slide, please. You can see that on this chart, you can see that women of childbearing age were the category that had the largest percentage increase between February 2021 and February 2022. And if you're looking at real numbers, that's 56,727 women of childbearing age who gained Medicaid coverage during that time. These are women who are pregnant and more likely to have a healthy pregnancy. They're women who may have recently had a child and can now access healthcare during those critical 12 months after giving birth. Or maybe it's a woman who is getting healthcare now, so that in the future, she becomes the mother of a healthy baby. Next slide, please. So what's the future of the public health emergency? I guess 2 weeks ago, Secretary Becerra extended the public health emergency to July 15 of 2022. The Biden administration has promised to give a 60-day notice before ending it. So the next date that we'll be looking at is May 16th of 2022 to see if that health emergency is going to end or if it's going to continue. But the administration is not, I guess, the only arbiter of if it continues. Congress could act to lift continuous coverage protections, as the House did in the Build Back Better Act. Now, because that stalled, those provisions did not take effect, but there have been discussions in states about ending that. And moving on to that, states could reject the enhanced FMAP and return to regular operations. So those are two things that could happen outside the administration's decision to continue the public health emergency. And on that note, I will turn this over to Lauren Anthus, who is going to dig deep into the numbers for you.
Thank you much. Thank you very much, Kelly, and thank you, Kelsey and Sarah with Advocates for IO's Future, and welcome everyone to today's presentation. I'll try to keep it quick and tidy, but more than happy to answer whatever questions you all may have. Next slide, please. So if you don't know about the Center for Community Solutions, you can see our mission and our work here. I would also recommend feel free to reach out to us either on Twitter, or you can reach out to me specifically at my email, which you can see, or you can visit our website where we're publishing a lot of research and analysis regarding the public health emergency and its implications. We'll be continuing to monitor this and put out information as we receive it and are able to contemplate it. Next slide, please. All right, so first thing, and I know that Kelly touched on this a bit, but I think it's really important to understand what's happened with caseload under the public health emergency. Typically, Medicaid is referred to as the first responder in public health. What that means is wherever you see a major public health challenge, whether we're talking about the opioid use disorder epidemic or say infant and maternal mortality, we also see Medicaid play a role. Being an anti-poverty program, poverty having a relationship to many of these issues, it often is the thing that fills in when it's needed most, whether that's economic recession or otherwise. With the public health emergency and with COVID-19, Medicaid played a really specific role, not only in enabling the state to manage some of its finances, and we'll get into that here in a second, but also to serve as a backstop for coverage and access. There are recessionary impacts associated with the public health emergency, and we saw those play out in caseload growth rates. So if you look at January 2020 and compare that to January 2022, you can see that most of the coverage happened either with covered families and children. So those are adults, parents, and their kids. So about half of all caseload growth came for those two groups, or from the Group 8 or Medicaid expansion group. So these are folks who, either kids or working age adults who may not have been able to maintain their coverage and who needed a source of coverage. I think what's important to call out here is the relative lack of a caseload growth for the aged, blind, and disabled, who tend to be the most vulnerable folks when we're talking about COVID-19, because they're in either institutional settings or have other challenges. They may be immunocompromised. And while it's important that they maintain their coverage, we didn't see a lot of caseload growth there. We'll get into what the implications of that may be when it comes to the state's approach regarding eligibility processing here in a moment. Next slide, please. Okay, so Kelly mentioned this as well, but one thing I'd like to highlight here is the role that the federal government played in financing the program and making sure that states were not put in disastrous positions economically when it came to financing not only this source of coverage, but also its budgets, or their budgets generally speaking. So, if you look at the time frame here, and this is just in a single year, less than a year in 2020, you can see that the coverage increase came with that additional federal support. And what matters here is that most of that support actually helped defray some of the costs associated with age, blind, and disabled. So while the caseload didn't go up, that displacement of state match with federal dollars helped the state manage that caseload increase, and also helped the state avoid a number of cuts in other areas like education, corrections, and so on. So if you remember from 2020 during the summer, there weren't dramatic cuts across the board to state's budget because the federal share was able to disobligate the state in regards to state revenue. And it's worth about 106 million or so each month, this federal versus state match displacement, which means that it's also very economically beneficial to the state as it continues to contemplate how does it manage this caseload increase, how does it manage coming back economically. It's also a first responder, if you will, for public budgeting. So we had a caseload benefit, we had a financial benefit associated with public health emergency. Next slide. So this comes directly from the Department of Medicaid, and a couple of things to pay attention to when it comes to the termination of the public health emergency. First of all, Health and Human Services will provide 60 days notice prior to the end of the PHE. So that means if we don't hear from HHS by May 15th, then the likely termination date, which is currently set for July 15th, will be pushed back again. So that's an important date to just remember, that we will have 60 days advance notice. Most folks are thinking that we will get that notice by that time. And so that's when the timeline or the shift towards termination will start to take place. There's also federal reconciliation bill issues that are out here. Now, obviously, this has sort of been put on the back burner, but if Congress acts, it may change the ways in which states react to the termination of the public health emergency, or what their obligations to it may be. Lastly, I really want to highlight what happened in the last budget, House Bill 110. So in House Bill 110, the Ohio Department of Medicaid, through the Ohio Department of Job and Family Services, must complete all eligibility renewals and redeterminations within 90 days after the end of the emergency. So that's 3 months. Within 60 days of the PHE, ODM must complete and act on eligibility determinations for all beneficiaries who haven't had a redetermination in the last 12 months. And I believe there's an extension opportunity for larger counties like Franklin, Hamilton, and Cuyahoga to get to 90 days if they need it. ODM must seek approval from CMS to conduct redeterminations for all beneficiaries who are enrolled for more than 3 months during the PHE. What we've seen from the federal government is they are largely deferential to state processes, but they have some ideas about what they expect from states. Right now, the federal guidance essentially says the states should try to process eligibility over a year or more, and also make sure that that case management of determinations happens in a risk-adjusted fashion. In other words, that maybe more acute care need populations aren't unnecessarily kicked out of the program by however the state designs its plan. And then finally, ODM must employ a vendor to use third-party data to identify individuals who are likely ineligible. This is really important because depending on who we're talking about, there's incentives for this vendor to identify who is likely ineligible and connect that information on the local level at the county so that the county caseworker can make a determination. The vendor does not make a determination, the county does. And what's important here is, depending on the average cost of the individual that we're talking about, or what categorical eligibility group they belong to, the incentive changes. So that means that those individuals who are qualified as age, blind, and disabled have the largest incentive for the vendor to determine or to identify as ineligible. This is concerning, of course, because not only did we not see much caseload growth for this group, But it also means there's this sort of potentially discriminatory perverse incentive that would obligate the vendor to identify those who have the most need as being the most likely to be targeted for ineligibility. Next slide. Okay, so this is exactly what I was talking about. If you look at the different groups, and this is straight out of the contract with PCG, the Public Consulting Group, which has several contracts with the state, by the way. PCG will be credited for a percentage of the state's share of cost savings multiplied by the time each beneficiary remains ineligible, up to 9 months. So you can see here that the relative share for the population in question based off of the ineligibility then becomes a potential incentive. If you want a copy of the contract, I included it in the slides here under that link, but you can search for it under the controlling board during October, and you can find it as a part of the negotiation. So if you want to look at the contract in more in depth, you can find it there. Next slide, please. Yes, this is that point I was trying to make before I forgot about the animation. Sorry, Sarah. Next slide. Okay, so what are the potential impacts here? Number one, induced recession. So a study from the Commonwealth Foundation found that if disenrollment was accelerated from just a year to 6 months based off of the state's approach, that it could cost states jobs. Now, I mentioned before, we're actually accelerating it towards 3 months, but even based on that time frame, moving from 12 to 6, Commonwealth said that Ohio could stand to lose 51,000 jobs, including 30.5 thousand, right? So 30,500 individuals outside of healthcare, and ultimately reduce the state's gross state product by $5.2 billion. This is because if you suddenly withdraw those resources and create a condition in which people's coverage is suddenly evacuated, there's suddenly a loss of input from that economic stimulus, and there's also a lack of security for many individuals who have relied on this coverage for the last couple of years. Secondarily, increased government expense. What's important to understand here is that the eligibility system just doesn't happen in a vacuum. It gets managed on a local government level. So county governments will have to make the determinations, and they're the ones who have to go through that process. Just like any other industry, government is also facing staffing shortages, and there are many people at JFS departments who may not have ever done a Medicaid eligibility determination for. Additionally, counties may also be concerned about the penalties. So we've heard about payment error rate measures before coming from the federal government saying that Ohio's system for eligibility processing needed a lot of work. This is what was happening towards the beginning of the DeWine administration. Well, some of how that actually gets managed is on the county level. So if the federal government's concerned about the state, then the state's government's going to be concerned about the county. And I think there's an additional question of, if you have to process upwards of 3.3 million people through this system, is it accurate? How much pressure will there be on the local level to get that right? And then who is on the hook if it doesn't go well? Speaking of which, legal risk. In 2015, Ohio turned on its new eligibility system after reforming, meaning they were in a continuous eligibility pipeline up until they turned on that new system. And when they did, a number of people dropped off. The state of Ohio was sued, and then all of those individuals' eligibility was reinstated because of due process violations. So I would like to highlight that here because I think there are significant concerns here around the due process rights of individuals, as well as the potential discrimination that they may face because of this strange incentive that was baked into the contract mandated by the General Assembly. If anyone is interested in this, on May 2nd, myself and Ashley Socha from the Legal Aid Society of Columbus will be making a presentation to talk about what this may mean for agencies who are dealing with beneficiaries directly and how they can understand and identify potential risks. And finally, and certainly what I would argue is probably the most important, there are some estimates that up to 440,000 individuals in Ohio would be disenrolled. That number may be bigger, that number may be smaller. It's really hard to say. But trying to manage all of that work within a 3-month time frame is a pretty hefty task. So in many estimates, we have seen, and this number specifically comes from that same Commonwealth report, that 10 to 15% of total enrollees are likely going to be deemed ineligible. And there are many reasons why they may. There are a lot of folks who may have gotten work again, or their income's increased, or what have you. But this is beyond that, right? What if you're an individual who doesn't have the paperwork, or maybe you moved? How do we make sure that individuals get connected to the system so that they can maintain their coverage? I think that that is a significant concern. And there's something else that should be paid attention to here. If you suddenly or disenroll hundreds of thousands of people through Medicaid, that means that providers who serve that population suddenly have a new large uninsured pool. And when that happens, there's risk shift. In other words, they may have to go to their employer sponsored insurance plans and say, we have to raise your rates because we're losing out on the financial security associated with that Medicaid coverage. Next slide. Okay, and this is another thing that I'd just like to highlight, and this is from the Medicaid and CHIP Payment Advisory Commission. This happened earlier this month, and they were looking at the issue of churn, this idea of people coming in and coming out of coverage in the Medicaid program. And what they found is, after an episode of churn, beneficiaries were more than twice as likely to be hospitalized compared to baseline rates 6 months prior to disenrollment for all critical conditions. So when you think about the costs in our healthcare delivery system generally, one of the things that we know is that when someone is connected to a regular source of coverage, they're better able to manage their diseases, particularly chronic diseases like diabetes, hypertension, et cetera. When they lose that coverage, what we see is that hospitalizations go up, emergency departments go up. So there's a significant potential here that when people get disconnected from regular sources of care, that we're going to see illness predominate with that population. So we're very concerned about what that may mean, not only from a wellness standpoint and from a health standpoint, but also from a hospital management standpoint. If you have more people coming into your emergency departments, if they're missing regular sources of care, it becomes pretty disruptive for the regular course of care, generally speaking. Next slide. Okay, the last couple of things here that I'd like to highlight. The most important thing that anyone can do here, especially if you're working or client facing, is work with individuals to make sure that their information is up to date in Ohio's system. If they're able to do that through the self-service portal, or they can contact their county Department of Job and Family Services. And I would argue doing that earlier rather than later is the better way to go. Some providers, for example, if you're a part of a provider network, have started to include this information in after visit summaries. So if you are seeing patients right now who are on Medicaid, you could add it to the end of the note that you send with their packet of information, follow up in the electronic medical record, maybe try to do some case management. I would suggest that providers who have the ability to connect with their financial services staff and prepare for this and try to educate the beneficiaries in Medicaid who are also their patients as quickly as possible. Next slide, please. Okay, and I'd also just want to highlight the incredible work here done by the Ohio Association of Food Banks, Jory, who you'll hear from here shortly, and Zach Reet. They had put together some Navigator Consortium packaging materials, or a packet of materials that help market out the information associated with potential changes to the Medicaid program. So this includes a flyer with basic information, social media graphics and sample posts, a web banner highlighting some of these changes, as well as a web page where all this information is centrally located at getcoveredohio.org/Medicaid. I would strongly suggest for anyone who's listening here today to check out those resources, try to promote this information as much as possible through your networks, because the best intervention is prevention at this point. There's more that we can do later on, and we'll talk about that on May 2nd with the legal aid webinar. But for now, do what you can to get this information out to beneficiaries so that whatever happens, they can get connected to a system of coverage rather than be disconnected. Okay, with that, I think that terminates our time for our presentation, and we'd be more than happy to answer whatever questions you have. Thank you.
Excellent, Lauren. I will give you two very, very brief questions we have from the Q&A here, in 30 seconds or less. What are other states doing to prepare for this Medicaid unwind that Ohio can emulate?
Yeah, Ohio has already implemented a number of changes to the basic eligibility engine sitting in the background of the system, much of which was mandated by the federal government. I think that will do a lot. I would also say that the work that AOF has done is really showing some leadership, and we've already heard very positive remarks from national partners trying to replicate exactly this model.
Very kind of you. Thanks, Lauren. Very quickly, last question. Are there any extra resources or funding from the federal government for the Unwind specific to Medicaid?
There are some grants that have come out. I would say, first connect with some of the partners at the Ohio Association of Food Banks. I think that would be a good first step. Also, we have to see more from the Ohio Department of Medicaid. There was some rumored packet that they were putting together. There's additional resources that they put aside in the state budget to help with the management of this transition. I think a lot has to be figured out, but on the federal level, there's some information available through the guidance. I'm more than happy to follow up with you individually.
Excellent. Thank you so much, Lauren and Kelly. We appreciate you so much. Moving on to the nutrition portion of our presentation today. Very excited to introduce and welcome Hope Lane and Joy Novotny and thank them for their leadership on our nutrition work group. And the floor is yours. Take it away.
Thanks, Kelsey. Hi, everyone. Thanks for joining us today. My name is Hope Lane Gavin. I'm a Health Equity Fellow here at the Center for Community Solutions. Also on your screen is my colleague, my dear friend, and my co-chair, Jory Novotny from the Ohio Association of Food Banks. Next slide. So the purpose of this group, and I know that Kelsey has already kind of highlighted this, but is to prepare beneficiaries, community orgs, and messengers of the incoming COVID cliff the best that we can. So who is at the table? So for our public health emergency Unwind group that's focused specifically on nutrition, we have some advocacy organizations, including the Center for Community Solutions, of course, the Ohio Association of Food Banks, the Children's Defense Fund of Ohio, COHIO, which is the Coalition on Homelessness and Housing in Ohio, Policy Matters, Northern Ohioans for Budget Legislation Equality. We have some direct service folks, a lot of legal aids across the state, Greater Cleveland Food Bank, the Children's Hunger Alliance, the Ohio Department of Job and Family Services Directors Association. And we've also had some special guest appearances from state agencies, including the Ohio Department of Job and Family Services, the Ohio Department of Education, Ohio Department of Health, and the Ohio Association of Area Agencies on Aging. Next slide. So the objectives of our group, again, Kelsey has kind of already highlighted this, but is to ensure consistent messaging among advocates and providers, provide a space for policy advocates and direct service advocates to parse through communication strategies for upcoming changes, provide opportunity for advocates to gain face-to-face time with state agencies, provide an opportunity for action when necessary. So sign on opportunities for organizations, letters urging Congress or the Ohio legislature or a state agency to take action. And get news out to clients quickly on issues, including any issues with the Ohio Benefits Self-Service Portal, issues with Walmart milk on the EBT system happened a couple weeks back, and we were able to disseminate that information very quickly, and JFS office closures, etc. So the programs that we will be highlighting today are within the SNAP program, so higher base benefits, the emergency allotments, online purchasing, and some process and policy waivers that were enacted. We're going to touch on WIC and other child nutrition programs briefly, as well as the pandemic or the PEBT program. And Jory, this is you.
Thank you, Hope, and I invite you, Hope, to jump in and join in on anything that I might miss in covering SNAP to begin with. So just to make sure we all have a shared understanding of what we're talking about when we talk about SNAP, it's the Supplemental Nutrition Assistance Program. It is our nation's first and most critical line of defense against hunger. Currently in Ohio, our caseload is right around 1.5 million Ohioans who participate in the SNAP program. You may know it by its previous name, food stamps. The benefits are also issued on an EBT or electronic benefits transfer card. In Ohio, we called it the Food Assistance Program, but all of those are the SNAP program. And the SNAP program really is designed at its core to be a crisis and emergency response program. Often and most normally, that's an individual household crisis in which SNAP responds. So you're a family, a working person in your household loses their job, SNAP is there to help you fill your food gaps as you seek out new employment. SNAP also responds during natural disasters. We don't often see so much of this in Ohio, but we've had recent tornado devastations in parts of our state. Disaster SNAP can help respond in those situations when folks are facing a sudden loss of income and inability to meet their food needs. And of course, during the COVID-19 pandemic, we saw a massive, far-reaching public health crisis. So a crisis that was shared for all of us, and SNAP was really ready to respond more quickly than really any other response programs. You can go to the next slide. So just a reminder for how folks qualify for SNAP in Ohio. There are several factors considered to qualify and be eligible and participate in SNAP. And these are tied both to federal parameters for the program, and then these are the thresholds at which Ohio opts into eligibility within those federal options. So households have to first meet a gross monthly income test, and aside from households with elderly or disabled individuals, that gross monthly income is at or under 130% of the federal poverty guidelines. And then some of their household expenses are deducted to calculate their net income. And their net income has to be under 100% of the federal poverty line. You can see an example on your screen about the eligibility thresholds for a family of 3. And then within that net income calculation, there's a determination made about how much of that household's income might be left in an average month to help them afford to purchase their own foods, and then how much SNAP should respond to fill that gap. And of course, SNAP is not funded in a way that normally provides enough funds to cover a household's full grocery budget. It is named Supplemental Nutrition Assistance Program, and I think the vast majority of participants would attest to the fact that SNAP does not normally meet all of their food budget needs. You can go to the next slide. So SNAP emergency allotments, however, were put in place immediately as part of what Kelly mentioned at the top of the webinar, the Families First Coronavirus Response Act. So all SNAP households were brought up to the maximum benefit for their household size, which we'll go into some scenarios about what that has meant in real terms for different households with different income sources and different sort of demographic makeups. And then several months in the pandemic, there was a recognition by USDA that they were applying congressional intent inadequately. So at that point, the increase to SNAP benefits was adjusted for households that were already receiving the maximum benefit. So those households are receiving an additional at least $95 per month. So basically that USDA application acknowledged that every SNAP household should be receiving at least $95 more per month while the federal public health emergency is in effect, in addition to whatever their normal household benefit was. You can see on this slide what those maximum benefit amounts are depending on your household size. Next slide. So we have a few examples from research that we partnered with the Center for Community Solutions led, and we partnered with them on, about different ways in which these SNAP enhanced benefits during the pandemic have really helped households really significantly. So this first slide has a few examples of scenarios for a household with one parent working full-time at minimum wage. So you can see how the temporary SNAP benefit has drastically increased their purchasing power for families. All three of these situations, they are receiving an additional several $100s per month to help them afford enough food for their families. And we've conducted some initial surveys with folks who are counting on SNAP, who definitely are telling us what you might expect to hear, that prior to the pandemic, on their pre-pandemic SNAP benefit, they were not able to afford all of their food needs, and that these enhanced SNAP benefits have helped them to stretch their benefits further, especially given all the inflationary pressure that we're seeing right now in households, of course. So we'll look at the next slide, has some other examples. In these circumstances, this is a family of 3, a single parent with 2 children. And you can see how under normal SNAP benefit rules, as families have more income coming in, they are normally eligible for a smaller benefit amount, because the way that SNAP benefits are calculated, it's based on, again, how much net income this calculation determines that family is likely to have left over each month to buy their own food. So in the blue, you can see how the benefit levels normally taper off as workers attain a little bit gradual increase in how much they're earning and how much time they can spend in the workforce, etc. The emergency SNAP allotments have really brought our frontline workers up to a place where SNAP is a place, one of the few places, maybe the only place, where those frontline workers have really been rewarded for what they've been doing, putting themselves in the line throughout the past 2 years, working tough jobs, often in the public service sector, in the retail sector, and they've seen their SNAP benefit increase, which has helped stabilize them, help them offset the increased costs they've experienced to keep going to work, right? To keep affording the childcare they need, depending on whatever the situation may be. And we'll go to the next slide for one more important scenario. It's really critical to think about, which is how SNAP emergency allotments have impacted older adults, as well as people living with disabilities. So you may sometimes hear stories about how often older adults are eligible for a limited amount of SNAP benefits. And that's because the way that SNAP benefits are calculated, again, assume in most cases that older adults with fixed income sources and often with more limited household expenses, maybe because they own their own home, having paid a mortgage for many years, maybe because they don't have childcare expenses, right? They're often eligible for a much smaller amount. And during the pandemic, older adults and people living with disabilities have seen some of the most significant increases to their SNAP benefits. You can go to the next slide. So just again, to reiterate, the SNAP emergency allotments went into effect very early on in the pandemic, and they were tied to both a federal and state declaration being in effect for those SNAP emergency allotments to continue to be issued. As our health colleagues covered earlier, the federal public health emergency declaration is currently extended to July 15th. So we will know mid-May likely whether or not that public health emergency at the federal level will be extended. And SNAP emergency allotments do also depend on a state level declaration. So while our public health emergency declaration was ended by the General Assembly last summer, we do have an administrative economic declaration of disaster, which has been maintained to protect these SNAP emergency allotments, which are really providing not only a lot of additional security, important security for households to afford the nutrition they need, but also providing a lot of economic stimulus, especially for those retailers who are dealing with all of the different food supply pressure and navigating that. So next slide. So just want to make note, just to paint the picture of the size of this impact. We're talking about more than 700,000 households that have about 1.5 million people in them total, receiving about $120 million per month in additional SNAP benefits that they otherwise would not normally be receiving. So we estimate about 1/3 of the SNAP benefits currently being issued will end when SNAP emergency allotments end. This is going to be a devastating toll for a lot of our low and moderate income families and seniors and older adults and people living with disabilities to absorb. So if you're working with clients, just important to note that they are currently receiving 2 separate issuances of benefits. They're receiving one at the beginning of the month and one toward the end of the month. That second issuance toward the end of the month is the extra benefit that will go away when SNAP emergency allotments end. And while we don't know exactly when that will be, it may be helpful to start having conversations with your clients about what they can expect and what's on the way. And next slide, and Hope, you can take over.
Perfect, thanks, Shori. So I'm going to talk a little bit about SNAP and college student eligibility. So college students, even those with documented low income based off of their FAFSA and others, are normally the most restricted from participating in the SNAP program. So students enrolled full-time cannot typically participate in the SNAP program unless they also work 80 hours a month or care for young children or are deemed disabled. But because of the COVID-19 pandemic, there were temporary rules issued in congressional COVID legislation. So these rules is deemed that students eligible for work study. Eligible for work study does not mean that they have to be currently working. As we know, many campuses closed or are partially closed or have shut down different departments and things. So you must be eligible for work study. You do not have to be currently working or have a $0 expected family contribution and meet all other eligibility and income tests. And so this has been huge for low-income students in our state and in this country. Though after the public health emergency expires, the SNAP rules for college students will go back to what they were previously, unless there's some congressional legislation to try to make these rules permanent. Next slide, please. So SNAP and college student eligibility. So eligibility expanded until 30 days after the end of the federal public health emergency. Eligibility remains effective until the first recertification of a household beginning no earlier than 30 days after the public health emergency is lifted, meaning anyone who applies or is recertified prior to 30 days after the public health emergency is lifted can still qualify under these temporary rules until their next recertification. So the EATS Act, which is a congressional bill, would make this expanded eligibility permanent. Next slide. Also with the pandemic is online shopping kind of came on the scene. So the United States Department of Agriculture actually approved a SNAP online purchasing pilot, which would allow SNAP benefits to be used at retailers online back in 2014. But at the beginning of 2020, only 8 states and a very few retailers were onboarded onto the program. As we all know, the pandemic revealed an urgent need for grocery shopping alternatives, such as curbside pickup, delivery, self-checkout only, etc., to comply with social distancing recommendations and stay-at-home orders. USDA expedited the pilot program, and Ohio was onboarded in June of 2020. We are continuously adding new retailers to the program. It causes retailers to have to do some work on their end with their point of sale systems to be able to accept SNAP online. Therefore, there are certain retailers in our state, and we'll go over those in the next slide, that are operating online but not online in other states. And so it's kind of a mixed bag around the country right now, where there's certain retailers in certain states that are able to use SNAP online, but not in other states. The biggest challenge with online purchasing, however, for SNAP recipients is you cannot use your benefits to cover the delivery or the pickup fee. And so that requires a credit or a debit card on file in order to access those services. Even if you are utilizing, there are a lot of programs that have free delivery for the first 3 or so deliveries or free pickup, etc. But you still have to have a credit or debit card on file. And we know that there are a lot of low income unbanked people in our state. And so this has become a challenge for many families. Next slide. So this slide we actually created for the group to kind of raise awareness about SNAP online purchasing. Actually, I think since we even made this this flyer, 1 or 2 more retailers have come online since then, but you can kind of get the idea. And so this is an example of some of the materials that our work group has kind of worked up for public facing. So can I use my Ohio Direction card to buy groceries online? What about my PEBT card? So both of those, and I know Jory's going to talk about PEBT after I'm finished, but both of those cards can be utilized online. But like I said, they cannot pay any fees like delivery or service fees with your SNAP or EBT benefit at this time. Which stores let me shop online with my SNAP EBT benefit? So right now, Aldi, Amazon Fresh, BJ's, Earth Fare, Giant Eagle, and Walmart. I know that Kroger also allows curbside pickup with SNAP. And so again, this is kind of ever changing, but I just wanted to give you guys an idea of how this works. Next slide. So we're also going to talk a little bit about the WIC program. So From December of 2019, right before the pandemic, to December of 2021, our WIC enrollment in Ohio has decreased about 16%, which is about 30,000 recipients. The WIC program is crucial. It's the special supplemental nutrition program for women, infants, and children. WIC waivers have included a physical presence waiver and a remote benefit issuance waiver. But unfortunately, Ohio is still one of just 9 states that still requires in-person office visits to reload your WIC benefits. So there is no online or automatic issuance in our WIC program in our state. And so because of this, we kind of attribute this significant decline, again, 16% over the pandemic, to the issue of WIC beneficiaries not being able to reload their cards unless they drive physically to the WIC clinic. The latest omnibus package extended the boost to WIC fruit and vegetable vouchers through the end of the federal fiscal year, which was September 30th of this year. And so typically, the fruit and vegetable voucher is $9 a month for kids and $11 a month for women. But now it's $24 a month for kids, $43 for pregnant and postpartum women, and $47 for breastfeeding parents. And so this has been a huge help. Actually, myself and Catherine Unger with the Children's Defense Fund Ohio are conducting a statewide WIC project right now. And through our interviews with both recipients and WIC employees, this is the most significant boost to the program in the program's history. And most of the recipients that we are speaking with have utilized their full fruit and vegetable voucher every single month since the increase. And so this has been a major plus to the program. And there are folks in Congress trying to make these changes permanent as well. But we have a lot of work to do in our state to get enrollment to get enrollment to match eligibility of those who are potentially eligible for the WIC program. Next slide. And Jory, I think this is back to you for more child nutrition.
Yeah, I'll be brief on pandemic EBT. I do want to highlight how really crucial this was for families with students as well as kids under 6 in SNAP households. So if you're not familiar with the pandemic EBT program, you can certainly still visit ohiopebt.org to learn some more and see the resources that have been used over the course of the implementation of this program to help inform families and providers and schools. Huge shout out to our state agencies, the Department of Education, the Department of Job and Family Services, who have really been national leaders in implementing this program in Ohio. We've generally had really significant success in comparison to a lot of our peers across the country. So this was a big policy and implementation win for nutrition during the pandemic. Of course, earlier in the pandemic EBT, when we were all shut down, provided basically the replacement value for school meals missed. It did so on an extreme delay, of course, because there was a lot of input that had to happen to orchestrate it. But those funds helped families with children who normally receive free reduced price school meals to be able to afford some food to fill those gaps. And we also have had summer EBT benefits. However, this coming summer and next school year remain very uncertain. This current school year, we're one of really only a much smaller amount of states that have been approved to issue benefits. And we only now are able to issue them when students are absent specifically due to COVID-19, if they themselves are ill or in quarantine because of exposure. So more to come, we'll see what happens here. Next slide. Also want to just make quick note that we've had a lot of waivers that the Ohio Department of Education has secured from USDA that has allowed schools and meal providers to operate with more flexibility. So for those who don't work in this day to day, a lot of this is like legalese, technical, wonky language, but really important to note that these waivers have been in place throughout the pandemic and been really critical. Probably the most important one that schools will tell you is that for their nutrition service departments, they've been able to utilize the seamless summer option waiver, meaning that they've essentially been able to provide next to universal school meals. So most schools in Ohio have been providing universal free school meals under that waiver, and they've also been receiving a higher reimbursement rate as part of delivering that meal. That is all going to go away. Congress did not take action to extend these waivers any further, So schools have been instructed that for the coming school year, they'll need to be back to normal. They'll have to be sure to be collecting, for those that don't have community eligibility in their schools for free meals, they'll need to be collecting those applications. They'll need to be, confirming eligibility on that. And they will go back to receiving their normal reimbursement rates for operating the National School Lunch Program. Another important waiver that was in place for our summer providers for when kids are out of the school building and need meals is a non-congregate feeding waiver, as well as waivers around, picking up meals. Basically, that means consuming the meals at home rather than physically getting the child to a local provider to consume their lunch on a Wednesday in July on site. They've been able to, in many cases, go to a local provider, pick that meal up and consume it at home. They can sometimes pick up a week's worth of meals. That flexibility will also go away. Next slide. There's been a push to encourage Congress to extend USDA's authority to make these waivers available. As I mentioned, Congress did not include that in their most recent omnibus package. So the waivers are all set to expire June 30th. That you may have heard over the past week, USDA did provide a little bit of flexibility to states so that they can operate, that basically they're allowed to pivot temporarily in the summertime to a non-congregate feeding model if, let's say, they have a COVID-19 outbreak at their summer site. So the Ohio Department of Education will work with their sponsors to provide more information about that in the coming weeks. But for the vast majority of providers and children, they'll have to go back to normal summer. And we know that normal summer food service program was only reaching about 1 in 10 eligible kids. Next slide. Additionally, from our perspective as food banks and kind of crisis food providers, we also receive some temporary boosts to our federal commodity programs and different sources of food that helped cushion some of the blow earlier in the pandemic when we saw our demand skyrocket, as I'm sure most of you are familiar with. Most of those sources of food have since dried up. Similarly, or at the same time, we've seen donated foods from our retailer and manufacturer partners at record lows. And of course, for us, as well as all of you purchasing your own foods, our input costs from the cost of food, transportation, fuel, labor, all at record highs. So our food banks are purchasing foods at incredibly high rates, unsustainable rates, and we're really going to need help additionally to respond when some of these pandemic-related food benefits go away. Next slide. So to summarize the situation we're looking at from a nutrition perspective, although we do have that modest win on WIC increased benefits for the families in those situations, the pregnant women and women and caregivers with young children. Most Ohioans will be losing SNAP emergency allotments on average $80 per person per month. Many will lose access to free school meals or expanded access to summer meals, all at the same time that we're facing record inflation and food costs, incredible food supply chain pressure, not only from COVID and all of the escalating factors there, but also, of course, the war taking place in Ukraine. And then we also, as emergency hunger relief providers, have less tools in our toolbox and less food on the shelves to help fill those gaps. Next slide. So our committee has been developing a packet of resources to help make sure, I saw some questions in the chat about this, make sure that folks are educated and informed about what's coming. And we are, of course, working as closely as we can with our state agencies to do that in concert with one another. So we have some recommendations here about how you can keep in touch. Those are our Twitter tags. If you're a Twitter person, encourage you to also get connected to the AOF weekly newsletter if you're not already. And please feel free to reach out to Hope and I directly as partners and messengers in spreading the word. Next slide. And then if you'd like to do even more reading, we will add you to our list. You can join our committee. And I've put a couple of links here in the slides for ways that you can make referrals and help your clients get connected to help as they work to fill those gaps and advocate for their rights. And that's it for us, Kelsey.
Jory and Hope, thank you so much. So we have just a couple brief questions in the chat here or in the Q&A, and I'm going to actually prompt Lauren and Kelly maybe to be ready for question number 2 as well, as a kind of a joint healthcare and Medicaid question. Really kind of gets to the crux of why we're here today and why we are trying to communicate some urgency around the cliff, because it's going to come faster, I think, than we would have imagined or we preferred, and everything that we have talked about so far today is going to hit at once. So very quickly, Jory, what is the state or governor doing right now about this potential huge loss of food money?
Thank you for the question. I would first just emphasize that we don't by any means think that this is the state's responsibility alone to carry. We're of course working on our end as a charitable network to do everything we can to respond. We're also advocating for our partners at the federal government to figure out ways to send us more emergency commodities, which they're able to do so with some limitations, of course. To be able to really respond, we'll need congressional action, which we are urging, and you can learn more about at our website. But we are also making a request to the state of Ohio to help us cushion the blow for SNAP, the loss of SNAP emergency allotments in particular. We don't have any promises of support at this point, but we continue to strongly urge Governor DeWine, Lieutenant Governor Husted, and our General Assembly to help make sure that we have the food we need on hand to fill the gaps as we approach this really big nutrition cliff.
Thank you, Jory. And to Jory, Hope, and Kelly, and Lauren, who is communicating these Medicaid and SNAP changes with recipients directly? And will any families lose Medicaid and SNAP at the same time?
I'll just say, yes, we expect that, unfortunately, the pressure that's going to take place on our county agencies, as Lauren talked about earlier, is going to impact the SNAP caseload as well. In fact, the folks trying to access and maintain SNAP are already impacted by the pressure our county agencies are under. So we're definitely concerned about folks losing benefits, both coverage from Medicaid as well as nutrition benefits from SNAP. I think we're trying as public partners to spread as much word as we can. I'll let Lauren talk about Medicaid in particular, but I think there may be plans from the state's end to provide text or robocall notices to our SNAP emergency allotment recipients. Outside of that, this is going to be a matter of folks recognizing, and a lot of them are going to realize come this summer that their benefits have significantly decreased without much warning.
If I could, before Lauren, the key here too is that the emergency allotments are coming in on 2 tranches. So like Jory mentioned, that you get your normal benefit amount at the beginning of the month, and then the emergency allotment in this at the end. And so what's going to happen is folks are going to continue getting their normal allotment at the beginning and then not get that second one. And so we are trying incredibly hard to convey this to beneficiaries. And it's tough for the state too, because the state is kind of looking to the federal government, because this also depends on the federal public health emergency. And so it's hard to communicate something that's so uncertain. And so we're just trying to keep the conversation going, which is why we've been meeting since September, with maybe ending in July. And so that's just something I wanted to add to, that it's going to be really tough because folks are going to continue getting their first benefit amount hitting at the beginning, and then they just wouldn't get the second one. And so we're trying to help folks plan for that. Lauren.
Yeah, thanks. So with Medicaid, I'd say a couple of things. I'd say the first thing to pay attention to is the obligations that the state has to issue notifications if they believe that someone is ineligible for the program. So there are specific requirements around mailed notices and efforts to reach out to individuals before you're allowed to follow through on a termination notice. So the state has its own particular function in this from a legal perspective, and there are longer timelines associated with appeals processes, et cetera. I'd also want to highlight that for the first time, or at least the first time that I've seen it, there was a waiver opportunity put forward by the federal government around the ways in which states can reach out to beneficiaries, including the incorporation of contact information from Medicaid managed care in the sort of pinging of individuals who are otherwise enrolled. Typically contact information that the government has or managed care has or from other resources is not very good at all times, right? Folks are transient, they may have moved around the last couple of years in particular. So I think there's going to be some efforts from the state to leverage some of the marketing material, but this is why I think we're having this webinar is to put it a different way. It's your responsibility to tell people, and it's all of our responsibility to tell people that this is coming, to prepare appropriately, to get the information out there, and to get people connected to those database systems so that at least their contact information is up to date, and at least they understand how to connect to navigator resources. So if and when they are either ineligible or they lose their coverage, that they have some legitimate alternatives available to them.
Excellent. Thank you, Lauren. Last question. I think you briefly touched on this. What kind of work is the state doing to direct Medicaid recipients to the marketplace or food program recipients to other programs when they lose benefits?
I'll kick us off and then hand it off. There's an explicit obligation on the part of states if they have income information relevant to individuals that indicates they're likely eligible for marketplace coverage, that they hand that information over to the relevant marketplace stakeholders. So, Ohio has sort of like a hybrid exchange that's mainly federally reliant. So if they have income information available to them to suggest that someone is ineligible, they have to provide that information to the marketplace management system, and also provide individuals with information like saying, hey, you probably qualify for a marketplace plan. I think that's particularly useful because for many years, there was a significant gap in coverage between where Medicaid expansion coverage terminated and around 200% of the federal poverty level. That's where we tended to see people drop off. And now the subsidies available through some of our relief efforts have made many of those plans go down to zero. This is why we've seen such significant enrollment in marketplace plans now. So let's say rely on your navigators. There is going to be some process in the background that the state is on the hook for, but where all else fails, healthcare.gov is always a good resource.
Yeah, and I'll be really brief. I know that we want to get to our family stability folks, but I would just say that I think that first of all, please look very soon for more resources from our committees on this as it relates to SNAP. But we've really been trying to get the timing right here because, as you can understand, this every 90 days we wait to hear if this extension will happen. And it's a lot of uncertainty for clients, of course, to live in. And so we want to strike a balance. And I think the state probably wants to strike a balance in keeping folks informed without alarming them unnecessarily. So I think we recognize as advocates that we're kind of at the point of no return, and we need to really be focusing on being forward and forthcoming with what's ahead as it relates to this oncoming cliff. So I would just echo that now's the time to act in every way we can together.
Excellent. Thank you so much, everyone. Moving on to our third and final portion of our presentation today. This will cover our kind of catch-all group, Family Stability and Supports, led by Tara Britton from the Center for Community Solutions. I'm also excited to have AOF partner Gina Wilt from Ohio here to help us support us in answering some questions about housing and emergency rental assistance coming up in just a little bit. But for now, Tara, go ahead and kick us off.
Thanks so much, Kelsey. And I'm learning a lot, even though I sit in many of these meetings, hearing from all of the smart people on this call. So thanks for pulling this together. Thanks for all of the work that you and Sarah are doing at Advocates for Ohio's Future to support us in our public health emergency Unwind work. So the Family Stability Group really looked at things that didn't fit into health and nutrition squarely. We have a much longer list of things that we're looking at in this group, and as things are changing, the agenda of our sort of subgroup around family stability changes as well. But a few of the areas that have consistently been part of our agenda are looking at the impact of the child tax credit, and of course, sort of the fact that those monthly payments have ceased related to the child tax credit. So I'm going to talk a little bit about that. Some changes related to the Temporary Assistance for Needy Families Program, or TANF. Those are a little less formal than in other places, but still important to acknowledge kind of the flexibilities that have been allowed in that program throughout the last 2 years. Kelsey, and she also mentioned Gina, is going to be on to answer some questions as it relates to housing. We have some things to highlight there. And then also student loans, which is not necessarily something that has traditionally been a part of AOF's or Advocates for Ohio's Futures portfolio, but want to acknowledge the impact that the pause on student loan payments has had over the last 2 years, as well as some of the more structural changes that are happening within federal student loans. Next slide, please. So just starting with the child tax credit, I think it's important here to acknowledge that, I think in addition to unemployment insurance, this is probably the next major change that has happened as it relates to over the last 2 years, we've had different changes in policy. And the child tax credit from July through December of 2021 was given out to families in the form of advance payments. They were also at a higher level than previously. And most families with children were receiving between $250 and $300 per month, depending on their child's age, between July and December of 2021. This reached over 61 million children in the month of December and kept over 3 million children out of poverty. Some of the work that's been done through census data, as well as other studies, have looked at what these payments were used for, and they were primarily for basic needs: food, clothing, shelter, utilities, education. January was the first month that had no advance payment, and the impacts were quickly felt. And so I think in the context of this larger conversation today, it's really important to acknowledge that the advanced child tax credit payments made a big difference for families. And we already saw an increase in the child poverty rate from December to January when those payments weren't coming on a monthly basis. Next slide. So moving into housing a little bit, I'm going to turn it back over to Kelsey to talk here. But I think, again, another big change that happened last year was the eviction moratorium ended in August of 2021. There was a lot of back and forth that you likely saw in the media around that. But just really briefly, some of the data tells us that in Ohio, there are over 230,000 households that are behind on rent, and even more who have little confidence that they can pay next month's rent. So putting that in the context of no more eviction moratorium, still in the midst of an unpredictable public health crisis, and we're looking at some scary numbers as it relates to folks not being able to maintain stability with their housing. And Kelsey's going to talk a little bit more about the emergency rental assistance piece of this, which has had its own sort of ebbs and flows throughout the last 2 years.
Certainly. Thank you so much, Tara. So wanted to talk a little bit about emergency rental assistance and that program, and really how it has helped support families as well as tenants kind of through the past 2 years. So since 2020, Ohio has received a large sum, around $1.4 billion in rental assistance, again, through a multitude of different federal bills that have passed, and those assistance bills. So lots of dollars coming into the state. And they have been kind of broken into two different allocations. We refer to them as emergency rental assistance, or allocation 1 and 2. So that first block of funding, again, were passed by Congress in December of 2020, and then were distributed to the states to really make their own decisions about how they would get those dollars out to folks, to tenants, to folks and landlords who really needed support during this time. So the state decided that the best actors to help get these dollars out would be through local agencies. So they left a lot of flexibility up to local agencies to decide how they would kind of process those applications, get those dollars out to landlords, and help families continue to kind of pay back the ever increasing kind of tab for rent. Because even though we did have a eviction moratorium, the monthly rents were still due each and every month for a very, very long time. So you can imagine kind of how that bill ticked up while that moratorium was in place. So again, different county, lots of county community action agencies and such took the lead in getting those dollars out to folks. And in an effort to make sure by the federal government to make sure that the states and the local agencies were doing their due diligence and getting those dollars out to folks, they did set minimum spending thresholds to make sure that the states, counties were getting those dollars out to folks and local agencies. So in order, so really at the end of last year, the federal government took a survey and seeing kind of how the local agencies were doing in getting those dollars out to individuals and to tenants. And they saw that Ohio really, compared to other states, wasn't getting those dollars out as quickly as possible and had not reached their minimum spending threshold in getting those dollars out. Unfortunately, there were some ramifications to that. The federal government did claw back some of those dollars, thankfully, and redistributed them back into Ohio so that they can still be used in Ohio communities and support different Ohio families. Ohio still has also received the second tranche, that second bucket of emergency rental assistance dollars to go out as well. And we do know that the state is doing their best to help support our community action agencies and local agencies to kind of maybe help streamline that process, maybe centralize it a bit for that intake and doing some maybe additional or initial eligibility checks. But we do know that this whole process has been challenging, not only, again, to put on the local agencies to process all these applications, they've also dealt with standing up brand new programs to get these dollars out, and as well as evolving kind of guidance and reporting requirements from the federal government, constantly changing. Once you get a system in place, the rules change, and that can be very, very frustrating, as well as we know a lot of different community agencies and a lot of folks right now are facing staffing shortages and challenges. So we know that, again, excited for our county agencies to do their best and get those dollars out, and we there support them. We know that the state is looking for different ways to do that as well. So as of now, again, ever since the federal eviction moratorium ended years ago at this point, or last year, Supreme Court right now is processing over 7,000 evictions per month. So we know that lots of families continue to struggle to catch up on that rent bill. And, and I think in the context of our greater Unwind conversations, we do believe that maybe once the COVID cliff in terms of loss of Medicaid coverage, reduced SNAP benefits, and we know that folks have seen the end of the child tax credit payments, as Tara mentioned earlier, that more families may qualify for these rental assistance programs. So we are excited to hear more and really partner with our friends at Ohio and all of their local agencies and all the work that they've been doing to make sure that folks are aware of these programs, that the word is out, and helping to make sure that this process goes as smoothly as possible and supports both tenants and landlords over the next few months. So I think that is all I have for emergency rental assistance, and I'm excited maybe at the end our friend Gina can help answer some questions. But for now, we'll move on to Tana from Tara. Thanks so much.
Thank you, Kelsey.
Tara, you are muted.
I'm sorry. Yeah, I hit it and then it went away. So just in family stability, we're covering so many topics. So appreciate you stepping in, Kelsey, and for the help that all of our partners bring to that group to talk about different topics. So TANF is one of the areas where there were actually no federally mandated changes during the pandemic. The nature of sort of this big waiver program is that the state has some flexibility built in there. There were some, guidance documents released from the federal government to acknowledge some of the challenges with social distancing and not being able to meet work requirements when all of that was in place earlier in 2020. But wanted to just point out that, this program, the cash assistance portion of TANF in Ohio is called Ohio Works First. It barely expanded its caseloads in the spring and summer of 2020. So in terms of looking at Medicaid and SNAP, in terms of being so responsive to a crisis, really because of the hoops that are required to be jumped through for cash assistance programs, it ticked up a bit in terms of enrollment, but really returned to pre-pandemic levels by the end of 2020. And I just was looking at some enrollment data over the last couple of days, and really it is at some historically low levels in terms of enrollment now. So really, it's important, I think, to understand that there is a lot of access issues with enrolling in Ohio Works First. And as we see the end of these other programs and enhanced benefits, we really want to look at this in the state of Ohio to see that we can get as many people and families who are eligible, and these have to be families with children, into the TANF program as possible. We do know that non-recurrent benefits that were sort of processed through the TANF program in Ohio, we call that prevention, retention, and contingency, did play a role in providing some stabilization for families. And Ohio's model for doing that is actually, held up nationally, because we're able to get some, crisis avoidance type dollars, something that can help with a car repair, or if there are materials someone needs for a work assignment. So that helps to avoid a crisis and can help that doesn't count against the number of months that you are on cash assistance. That did play a role in the pandemic. Counties were able to access more dollars to feed that way into the community. But we do know that in terms of the cash assistance portion of the program, it really was not very responsive to the crisis compared to other programs. So, Advocates for Ohio's Future is doing a lot of work to look at that and see ways that TANF can be more responsive in the future. So I think now I'm moving into, and just really quickly, I think I have one slide here to really show you that, you can understand the number of crises in, we had a great recession in those years. You can see the tiny tick up of cases during the pandemic, early on in the pandemic. And this is national data, but really, since we changed TANF into a block grant program in the late 90s, it really has not been responsive to crises like other programs have. So this just shows you that. And then I think I'm moving into student loans, and I know we're hitting up against time here a bit, but I just wanted to quickly talk about the federal student loan payment pause. The initial pause on student loan payments began in March of 2020. The provision included not only a suspension of payments, but a reduction of the interest rate on all federal student loans to 0%, and then each month of non-required payments. So that's been since March of 2020, and the pause is still in effect right now, have counted towards existing federal loan forgiveness programs, including public service loan forgiveness, which I know is of particular interest to folks at nonprofits and public agencies. So I will talk a little bit more about that. The payment pause has been extended several times, as I mentioned, but the current pause is set to expire at the end of August of this year. And then moving into a little bit more about the impact here. So we know that from studies throughout the course of the pandemic, including a recent one from the Federal Reserve Bank of New York, show that if and when payments resume, there'll be a rise in payment delinquencies. And again, I think in the family stability category, the theme is, let's look at this in conjunction with what else is happening, looking at the end of the public health emergency as it relates to Medicaid and SNAP, the ending of the child tax credit advance payments. It's important to consider what adding your student loan payment back into your monthly budget would look like as these other changes are happening. We also know that in addition to challenges with household budgets, you have likely seen this in the news, the barriers to communicating with student loan servicers are very well documented. Two major student loan servicers are actually exiting the business of providing that servicing over the next several months. And so that adds additional confusion to the process. Moving into I think this moves into the public service loan forgiveness program. Just very briefly, the background here. Public service loan forgiveness, or PSLF for short, was signed into law in 2007 to offer federal student loan forgiveness to anyone who has made 120 total payments while working in the public or nonprofit sector. So I imagine that includes many of you on this call today in the nonprofit and public sectors. For the first people became eligible for forgiveness in 2017 because you had to make 120 payments since 2007. And problems with the program became very evident very quickly. Before last year, fewer than 5% of applicants for loan forgiveness were approved. There were a lot of reasons for this. Miscommunication through the loan servicer was a big problem. Uncertain status of your employer, whether they were truly a nonprofit or looked nonprofit-like. And another big issue was folks not understanding the payment type, payment plan type that they needed to be in. So a lot of that is being addressed through the limited PSLF program, which I'm going to talk about really briefly next. Last fall, the U.S. Department of Education announced the limited public service loan forgiveness program, which includes fixes to a lot of what I was just talking about. And nearly all of these problems were addressed through this limited program, including, making sure that every payment type, as long as you still have a federal student loan, every payment type, your payment plan, your payments are now being counted if you were working at a nonprofit or government public agency during that time. So far, about 100,000 borrowers have had their loans forgiven. And I want to point out, it's sort of like my personal mission. The limited nature of this program refers to it having an expiration date. So folks who are on track and want to make sure that as many payments can be certified as possible need to submit their employer certification forms before the end of October of this year. Anyone who thought, I was in the wrong payment plan all this time, I'm not going to switch now, you may end up having payments that can count toward forgiveness now. There's a lot of folks who, I think got caught in the confusion and enormous complexity of this program. The limited nature is tied to the public health emergency. That really is, kind of the reasoning behind looking at this, doing some overhauling of some of what happened in the challenges of this program previously. So it's tied, the limited nature is related to the fact that we're trying to address some of these problems during the public health emergency period. So I'm happy to answer more questions about that. I know that it was a very brief overview of something very complicated. I'm gonna put a link in the chat here that's a really helpful guide from the federal government to walk you through some of this. I'm trying to remember, I think I have one more slide just about sort of like actions to take. Here's another place where if, updating your information is really important. Make sure your information is updated with the federal government on the student loan site. Make sure it's updated with your loan servicers so that you're getting all of the notifications. Paying attention to these dates around the payment pause, when they might turn back on. Usually when the pauses have been extended, we've been given some indication from the federal government that that's coming. Make sure that you're saving documentation related to your student loans. And that's sort of on the federal side. There's a site where it tracks all of the loans that you've taken out from the federal government, as well as your loan servicer, and making sure you're tracking all of that. And then really, I think talking to employers is another good way to make sure folks know that this is happening. Raising awareness with employers is another part of my sort of mission around this, because I think could be a good recruitment tool, especially in the public sector, to say, hey, have you been working, in the public sector since 2007? You may be on track for this and you didn't know, but some of those payments are only going to count under this limited program. So time is truly of the essence. And then there have been, I'm seeing in the chat here, additional forgiveness around student loans due to disability. There have been additional changes actually just last week made around easing the process around the income-based repayment plans. So lots of, I think, bigger structural changes are coming to the federal loan program. But just, I think trying to focus on this limited piece that's very much related to, having the public health emergency in place, trying to process as much of this as possible before the end of October. So time is of the essence. And we have 1 minute left. So I don't know how many questions came in, but I'll try to get through as many as I can. And thank you all for your time today.
Absolutely, Tara. Thank you so much. And I'm going to, Gina, if you're with us, if you wouldn't mind hopping on, so happy and thankful that you could join us today. We do have a couple rental assistance questions directed to you. So if you wouldn't mind, we'll get to those very quickly first. Will rental help demand or rental assistance demand go up when these other benefits end?
It's hard to imagine rental demand going up any more than it is right now. But I mean, we don't see an end in sight. And I do think the demand is going to continue for lots of different reasons. And Kelsey did a great job talking about most of those reasons. Wages just simply have not kept up with the price of housing. And I think, if you've been out there, you know this is true, but the low wage jobs combined with these rising rents just puts housing out of reach for most people. So that's going to continue. I talked to a landlord the other day, and it's interesting that we have the 42 units there are 42 units for every 100 households in Ohio. So 42 units available for every 100 extremely low income households in Ohio. That's out of the GAP report. And just talking to a landlord the other day, they said they listed a apartment for rent in an affordable apartment for rent. And within 24 hours, they had 42 people apply for this 1-bedroom apartment in 24 hours. So the need is there, and the demand is going to continue. There's no end in sight right now. Hopefully that answers the question.
Thanks, Gina. One last question for you, and then we will close things down. There is one other question in the Q&A, and Jory did a better job of answering than I could have ever imagined to. So please refer to that question asked and answered in the Q&A. But Gina, one more for you. Why are some local governments or local agencies struggling to get out emergency rental assistance dollars when there continue to be evictions, and so many evictions? I know we mentioned 7,000 per month. Will this money be taken back by the federal government?
Yeah, so I think the community action agencies are doing the absolute best that they can. Their budgets increased quite a bit when the emergency rental assistance dollars flowed through. And there's just capacity issues, staffing issues. We needed really strong central leadership. I think that was hard because all the agencies do things their own different ways. I mean, who knows? There's lots of different reasons we could talk about potentially. But I think dollars will likely get clawed back. We were lucky with that first round. They sent those dollars back to areas within the state that did have, the larger, really primarily the larger areas of the state that had more capacity and were able to spend those dollars. My hope would be that this next round, that something similar would happen, but we're talking about a lot more dollars. So we would like to try and work more with the courts. So I feel like that's another step that we could take, working with the courts, at the court, with the landlord, with the tenant, and try to insert those resources at that process right then and there. Some areas of the state are doing that very successfully. We would like to model that in other areas of the state, but yeah, I don't really have a good answer for you. Sorry. Thanks, Kelsey, for giving me the chance to respond.
Of course, Gina and Tara, I want to thank you so much for your time this afternoon. To everyone still with us, I want to thank you so much for hanging with us all the way to the very end. There is a comment in the Q&A that kind of gets really to the crux of why we gathered you here today, why we wanted to gather our stakeholders. I know we have some folks from some staff from state agencies here with us as well today to really talk about. The quote is, "This entire situation of the last hour and a half sounds like a crisis more people should be talking about." That's why we're here, folks. We certainly need help. I know partners around the AOF table around our Ohio COVID Recovery Coalition table. We've been working again since last September, the middle of last summer, to think of how can we prepare state agencies, local agencies, recipients for what's going to happen, because I can just imagine being one Ohio family to, lose the child tax credit payments, to lose their health care, to see a significant amount of SNAP assistance dollars be removed from their monthly budget, hundreds of dollars, and then at the end of the year, have their student loan payments be turned back on. So we're really thinking about a precarious kind of stability and situations a lot of families already find themselves in today when these supports are still in place. So this will be the mission of Advocates for Ohio's Future and our partners here around the table. And I want to thank our speakers one more time so much for their time and their attention and for their work these past few months. We know it's just beginning. I know we'll be talking to other stakeholders, our partners, folks in the General Assembly, state agencies, local agencies about these changes coming down the pike, and wanted to plug one final time. So next Monday at 1 o'clock, we'll be joined by Lauren Anthus, as well as Ashley Socha from the Legal Aid Society of Greater Columbus, to talk about really kind of once the unwind happens, once those maybe termination or redetermination notices go out to folks, kind of what the next steps are, and how helpers on the ground, how maybe legal aids, navigators, or other folks can help to guide folks to support and really help strengthen that safety net after this cliff does hit. So I want to thank you again for your time today. Make sure you register for our next webinar if you're interested next Monday, and be sure to follow us on social media, on Twitter and Facebook for any additional information, announcements on what's happening with the COVID cliff, as well as make sure to keep an eye on our social media for later this week. We'll have some announcements, maybe some plans in mind as how we can, again, help the helpers and really strengthen different systems who are going to help a lot of these impacted individuals regain stability after the cliff does hit. So once again, thank you so much for your time. We are here to answer any questions you have. Thank you for the work you do, and we'll talk to you soon. Thanks, everyone.